My name is Rustin Moore, and I'm the Dean here at the College of Veterinary Medicine. I'd like to welcome you and thank you for joining us this afternoon. I hope this finds all of you and your family, friends, and colleagues healthy, safe, and well. Please make sure to keep your video camera and mic muted or off, which will help preserve bandwidth. Please use the Q&A function and or the chat feature, whichever one you may have access to submit any questions that you would like the panel to ask. We have received questions from people who registered in advance, so we will be directing many of those throughout the time we have this afternoon. It's certainly been a tumultuous year. The college and our veterinary health system have had to make some pretty quick changes to be able to operate and to continue to address the challenges and uncertainties we've had. We know it's also impacted many of you, and we appreciate your continued support and also your understanding and appreciation or patience. So thank you. Today we're going to talk about some of those changes and their impact on how we teach, how we learn, our students learn, and also how we serve. We also wanted to share some more about the important work that our faculty and staff and students are doing to impact the response to our COVID-19 or the COVID-19 pandemic. So let's begin by me first introducing our panelists for today. And as I do, please, panelists, turn on your video. First, I'd like to introduce Dr. Michael Oglesby, professor in the Department of Veterinary Biosciences, former chair of the Department of Veterinary Biosciences, and currently the director of Ohio State's Infectious Disease Institute. Dr. Oglesby and the entire Infectious Disease Institute has been integral to the university's response to the COVID-19 pandemic. Next, we have Dr. Emma Reed, Associate Dean for Professional Programs. Dr. Reed has really led the way as we've adjusted our curriculum to the hybrid model of delivery, and we'll share updates on the transition and plan moving forward, as well as some other things related to students. Next, please welcome Dr. Mary Jo Burkhard, Associate Dean for Faculty and Staff Affairs, Inclusive Diversity and Planning. Health, well-being, diversity, equity, and inclusion have been integral parts of our strategic plan, and she has worked tirelessly to incorporate and help incorporate some of these priorities into our working, learning, and serving environments, and continues to address the health and well-being challenges of the pandemic. Next, I'd like to introduce Dr. Roger Fingland, Executive Director and Chief Medical Officer of our Veterinary Health System. Like many of you, our college, our college and also our veterinary health system has had to adapt to the way we deliver patient care and client services while adhering to the COVID-19 safety guidelines. Under Dr. Fingland's guidance, we've been able to continue operations and also start construction on the Frank Stanton Veterinary Spectrum of Care Clinic, which we'll discuss later. And last but absolutely not least, Karin Zuckerman, Director of our Veterinary Medical Center. Karin's leadership and her team has really enabled our Veterinary Medical Center to maintain the same excellent level of patient care as well as client service throughout the last several months. And this is something that's been integral to our success and also in helping to maintain our clinical education as well as being partners with our referring veterinarians. So first, I'd like to address the first question to Dr. Reed. And there's actually two parts to this, so I'll ask you the first part. Can you tell us briefly a little about how our students are learning this semester?
Sure. So I will say that the content is not a whole lot different than it has been in semesters past, but what's changed obviously is the delivery. And so the Office of Teaching and Learning in the college, which is headed by Dr. Jen Ganya, who is a teacher and has a PhD in educational psychology, she came up with what I thought was a fairly innovative course that would teach faculty how to make an online course. And the online course basically had all the best practices recommended by the Office of Distance E-Learning and Education, and also met the requirements for the state and for federally for accreditation as far as online courses go. So they made this course to help the faculty develop online courses. And then these online courses have been used to instruct the students both in their core and elective courses. And so what's happening is the students are taking all these courses asynchronously. So they're signed up and they're doing these courses basically at their own pace, but we are pacing the courses out module by module over the week. And then they have certain times during the week where they have synchronous time, where they end up with the faculty, and the faculty sometimes use that for lecture, sometimes use it for case-based learning or question and answer. So the students have a chance to interact with their classmates and to interact with the faculty members in that kind of virtual environment, much like we're doing via Zoom, but also using the breakout room feature. There are some courses that are in person. So clinical skills would be one of those where they're able to go to the lab and interact with instructors and with each other. But unlike pre-COVID times where we were instructing about half the class at once, we're now only able to instruct about 20 students at a time in order to space them appropriately across the lab. And so this means our faculty are teaching in small groups and doing about 9 groups or so over the week. So it's a lot of repetition for the faculty. And they have a lot of patience and they're putting a lot of hard work into it.
Great. Maybe touch a little bit more on how do we ensure they're getting the same level or perhaps even better by delivering this in a hybrid manner. Maybe you define the hybrid part and then answer that question.
Sure. So the hybrid basically means that they're mostly online, but they have some in-person components. So some of the courses, like I said, are actually in person, and clinical skills being one of them, small animal operative practice in the 3rd year, intro to surgery. Those courses, they're coming in, they're working in person, they're being tested in person. So we're still conducting OSCEs, or objective structured clinical exams, where we are grading the students against a checklist and making sure that they can do their skills. Some of the courses that are more didactic, so those core courses or elective courses, they're being tested using assignments, using group work. Some of them have take-home exams or collaborative exams where they can complete them open book style. And sometimes we actually bring them in and test them in the college, where we spread them out across 6 different spaces, the 4 lecture theaters and 2 other really big rooms. And we have the professional program staff supervise their exams for them.
Great. Thank you, Dr. Reed. Let's move on and learn a little bit more about the impact veterinary medicine has had on the COVID-19 pandemic. And this is going to be addressed to Dr. Oglesby. So Dr. Reed, you can turn off your video. I do want to mention to all of our attendees that when you're viewing this, if you're viewing and seeing all speakers, then you can change your setting to speaker view so that you're only seeing the person who is actually speaking. So Dr. Oglesby, the first question to you is, can you tell us more about why veterinary medicine and the One Health concept are so important in fighting pandemics like the one we're currently experiencing?
Sure, Rustin, and my video is blocked, by the way.
Can someone unblock Mike's video? And now, yeah, now you're muted.
Here we go.
You're muted.
There we go. I think everybody appreciates the fact that emerging infectious diseases reflect the interrelatedness of human, animal, and environmental health. And that really is the essence of veterinary medicine. At least that's been my view for my entire career. And that is the One Health concept. Where we've had tremendous impact is applying our understanding of animal coronaviruses to the current pandemic caused by SARS coronavirus 2. And we have an amazing group that has tremendous experience with coronaviruses of cattle, hogs, and also prior research experience with the first SARS coronavirus and the Middle Eastern respiratory syndrome virus. And Specific areas of focus include understanding cross-species transmission, so the spillover events, how we go from animals to humans, and then also humans back into animals that may serve as potential reservoirs. We studied disease mechanisms, and of course, this is essential to developing therapeutics. And in addition, there's a focus on understanding antiviral immunity. And you may know that Dr. Linda Safe is ranked as one of the top 10 investigators in the world in our understanding of immunity against coronaviruses. We have efforts in surveillance, and we have an eScout program that's led in the Department of Veterinary Preventive Med, looking at evidence of SARS coronavirus in water runoff, wastewater, domestic animal species. That includes companion animals, whether they're shelter or client-owned, in agricultural animal species, and in wildlife. And all of this really reflects what we do as the Infectious Disease Institute. So the college is not an island unto itself. We're really a vital component of a very large community of over 260 faculty invested in infectious disease research. That reflects 13 colleges in the Research Institute at Nationwide Children's, and our college has leadership in 4 of the 6 thematic programs of the Institute, and that includes viruses and emerging pathogens, host defense, which would be immunologically focused, microbial communities, which is a big part of our surveillance effort, as well as antimicrobial resistance.
Great, thanks, Mike. One follow-up question is, how is Ohio State navigating the pandemic in a way that at least some other institutions, and I'm talking about academic institutions, have not been successful? And maybe mention a little bit about the positivity rate and things that we've done to maintain that or gotten that down to a lower level.
Yeah, and just a bit of background. I serve on the University Comprehensive Monitoring Team, which has been planning our restart of in-person instruction for the campus, and that started sometime in late July. It's an amazing group. It's led by Dean Fairchild in the College of Public Health, and the expertise runs from microbial risk assessment to epidemiologic modelers to infectious disease physicians, virologists, me, and others. And we've used this modeling to identify behavioral and policy practices that can be used to minimize the spread of infection. We've worked closely with the governor, state, and local health agencies in developing prevention and mitigation strategies. So we're not making up things on our own. We're working closely with these groups. We've invested heavily in testing, and as you may know, we do weekly testing of all 12,000 students that are resident on campus. We do 8,000 weekly a survey of students living off campus, and we've begun surveys of graduate students and professional degree students. And testing doesn't mean anything unless you can back it with contact tracing. In other words, if you identify those infected individuals, identify the contacts, and both the infected individuals and contacts go into either isolation or quarantine, and the university is invested significantly in working with regional hotels for isolation and quarantine facilities. Our infection rates now for students is less than 1%. And to me, that's quite impressive, because when we started the semester, there was an initial peak, if you will, that got as high as 5%, but we're really quite effective in being able to drive that down. I do want to give a shout out to the students, because I've been incredibly impressed by students on campus in terms of their adherence to mask wearing and distancing measures. We have a dashboard, and this is the last piece that I'll comment on, the Safe and Healthy Buckeyes dashboard that provides all the data on test rates and our capacity for isolation, quarantine, disinfection. We've had 1.1 million views so far, and we were recently rated by a group of academic and medical experts from Yale, Harvard, Baylor, and OSU was in that mix. but we were one of only 184 institutions that received an A+ rating based on best-in-class practices and information that should be available for decision makers. So, the key to success is having all these pieces come together. If anyone is not on the table, then things can go the wrong direction.
Mike, two other quick questions. One, could you describe, I know we have some masters in public health, particularly the veterinary public health masters, as well as maybe some veterinary students who are involved as contact tracers. Could you describe sort of the experiences they get from participating in that?
Well, the students participating in contact tracing is huge. And I think it's an invaluable experience, not just for the current pandemic, but down the road. These individuals are taking test results. They're reaching out to the infected individuals, tracking down contacts. And I think this is where we go beyond theory to practice and identifying many of the social determinants of being able to implement a public health policy. And so I think that's the part that's invaluable, because you don't experience that in a classroom setting. We have a summer research student that's been working on research comparing genetic differences between SARS coronavirus 2 and the original SARS coronavirus to potentially gain an understanding of how immunity develops. We have public health graduates that are working with Franklin County Public Health, and this is huge because the University Comprehensive Monitoring Team is actually partnering with Franklin County Public Health in implementing our contact tracing program. That's something we had to have the blessing of Franklin County Public Health in order to implement.
Great. For all of those who are with us, I just posted a link in the chat for you, and this is really an article about Dr. Oglesby and the role he and others have played, and that's in the Ohio State Alumni magazine. So that would provide you with some additional insights into some of the things that are being done. Final question for you now, Mike. What have our experts done with regard to providing information to veterinarians and the public regarding COVID-19 and animals? And while you're talking about that, I'll post another link to that page while he's talking.
We have a college task force, and actually the task force has established quite an impressive web presence, providing information on SARS coronavirus and information that pet owners need to do, actually animal owners need to know. And I'd like to call out Janetta Quinn, who's in veterinary preventive medicine, and she's played a huge role in developing some of these communication pieces. And it really does cover everything from, what is the risk of infection to a dog, cat, ferret, mink. Do I need to be concerned about my cat becoming infected and transmitting infection? And these are questions that I think will come up with any veterinarian and probably almost any animal owner. And I'm really impressed by the effectiveness of that communication tool.
Great, thank you, Mike. Many of our faculty have pivoted also their research to address specific research projects that are helping to advance our knowledge and providing solutions to help us fight COVID-19 through some diagnostics. And so although Dr. Pat Green can't be with us today, I was going to just give you a taste of some of those things from some of our faculty. Dr. Shannon Lulu has established a rapid, sensitive, and reliable virus neutralizing antibody assay for testing the neutralizing antibody levels in COVID-19 patients, tested the neutralizing antibody levels among OSU healthcare workers, now is working on collaboratively to do the same in first responders, and has also participated in a randomized clinical trial nationwide by evaluating the response of the neutralizing antibody in those participants, and just is also part of a $10 million U54 NIH NCI grant that was just awarded to study this at Ohio State. So great job for him. Dr. Jangron Lee, another faculty member in the Department of Veterinary Biosciences, developed a recombinant measles virus-based SARS-CoV-2 vaccine candidates, which provided complete protection against that virus in hamsters. And so this is the measles virus vaccine, as you know, has been one of the safest and most efficient and effective human vaccines that have been used in children since the 1960s. So testing it in cotton rats for T-cell and other antibody responses to date with 2 different variants produced very good antibody responses. And that's just another example. Dr. Andy Bowman in the Department of Preventive Medicine has partnered with Ohio State investigators in ceramic engineering and pulmonary disease and critical care medicine. And they are testing a handheld breathalyzer device for COVID-19. And this study is ongoing with both animal and human studies underway. Dr. Amit Sharma in the Department of Veterinary Biosciences is one of 3 faculty members who developed very early on in this time of the pandemic a virus transport media that was developed at Ohio State, which is currently being used for COVID-19 nationally and internationally for transport media for detection of COVID-19. Dr. Sang-Gu Kim, another faculty in biosciences, developed a novel ultra-high accuracy long read genotyping tool for the individual virus and whole genome scale analysis of SARS-CoV-2. And that's obviously a very important aspect to basic science and how we certainly understand and can apply. Vanessa Hale, who is in the Department of Preventive Medicine, is working with 18 faculty from across many other colleges and teamed up on a project called eScout, which is environmental surveillance for COVID in Ohio and understanding its transmission. And that understanding how things are transmitted will certainly help us not only in ensuring we have appropriate preventive measures in place, but also to make sure we know if and when the virus is mutating or changing across environments and species around Ohio. And finally, and not everybody, but this is the last one I'll mention, Dr. Ian Davis in the Department of Biosciences is doing a series of studies of host-directed liponucleotide-based therapeutics for COVID-19. This is something that is non-specific for COVID-19, but has been shown up very effectively in a variety of laboratory models to help with limiting, preventing lung inflammation and therefore the serious side effects that are oftentimes what leads to mortality in people with COVID-19. And that's currently being evaluated in an in vitro model. And then we'll move into another model using live animals who are infected with COVID-19. So now we're going to move on to Karin Zuckerman. As many of you know, our veterinary professionals are essential workers, and at least in Ohio, thanks to Governor DeWine and others, they were determined to be essential workers from the very beginning. And we continue to work through the initial shutdown and are still continuing to adapt practices to address public health recommendations. So Karin, a few questions for you. First, what kind of changes have we seen throughout the veterinary health system to help keep people and our clients safe while continuing to provide the care and service to pets and other animals and their pet parents or animal owners?
Sure. So really, lots of changes have occurred over the last few months, but particularly in the areas of client access in and out of our buildings, our changes we've made to our facility, and then of course the use of personal protective equipment or PPE. Starting on the client management side, so our equine and farm animal hospitals continue to remain curbside only, which means clients really are not coming into the building except maybe briefly to unload one of their animals, and then they are exiting. The only exception to that is for cases of euthanasia. On the small animal side, we are now doing what we call kind of modified curbside. And so What this means is only one owner is allowed to accompany their pet into any of our small animal hospitals, either here on campus or at Dublin. The only exception to that is euthanasia, and then we allow two. We have greeters who are wearing masks and face shields that will immediately escort our clients into an exam room. Either a student or a staff member will come in, take a brief history, and then the client will exit the building at that point, and we will take the animal back into the treatment area. Primarily the remainder of the communication after that point between our clinical team members and our owners is via the telephone. We are not allowing our clients to wait in the lobby. The lobby is still closed. So they're either, sometimes if they're local, they'll go home. They might wait in their car. We have created what we're calling kind of our front porch. We've got some nice chairs, and over the course of the summer and now into the fall, we've got a lot of clients that are waiting out front. Those chairs are socially distanced, so everyone continues to remain safe. And then when it's time for the animal to go home, we are trying to do curbside discharge as much as possible, which means one of our team members or one of our students will bring the animal out to the owner's car, give them the animal back, any medications, etc. We are not allowing visitation in any of our hospitals for our hospitalized patients at this point in time. From a facility standpoint, on the small animal side, because we are doing that modified entry, we are cleaning our exam rooms between patients. We have installed plexiglass at all of our front counters to try to keep people as safe as possible. We've also got some mobile plexiglass barriers for some added protection in our exam rooms. And then we've tried to do a fair amount with signage, so people, reminders on the floor, but what exactly is 6 feet apart, reminders in our exam rooms for clients to keep their masks on, those types of things. On the PPE side, everyone is required to wear masks, clients, all of our team members within the BMC. We do have masks available should a client need one. At this point in time, that people are pretty well prepared and wearing their own masks. Early on, that was a little bit of a different story. And then in some cases, for example, euthanasia, we have more stringent standards. So people in those cases are masked, face shield, gloved, gowned, etc.
Great. So how was the caseload through the first part of the pandemic, and what did we do to provide care while being diligent about conserving PPE?
So the caseload was down about 30% in total, which for us is about 4,400 cases between mid-March and the end of June. Interestingly, during that time, that's total, but our ER caseload was up over 20%. So we were very busy in the ER, and we continue to be so today, but our specialty services were quite down. So in total, it's about a 30% drop. Some of the things that we did in terms of balancing care and PPE diligence, we started out only seeing emergency and urgent cases. When we were ready to begin reopening our specialty services, we did that over a gradual, gradually increased over about a 6-week period of time. And we did take PPE usage into consideration as we were deciding which services were going to reopen when. We were using reusable masks at the beginning. We also, our colleagues over in the Clinical Skills Center made face shields for us, so we were using those. And then we also have reusable surgery gowns available if needed. So we tried very hard to maintain reusable PPE products as much as possible.
And finally, for now, how has the caseload and revenue been since starting so in the first 2 or 3 months of the new fiscal year starting in July?
Yeah, so the first 2 months this is a little tricky because on top of everything else, we decided to implement a new hospital information system. So we're in a transition, but it's looking like our overall caseload for the first 2 months of the year is up about 3%. But again, ER is up 20% for the first 2 months, which is well over 200 cases. So pretty busy, and financially, our revenue is up about $400,000 for the first 2 months over the same time period last year.
Great. And just a couple comments, you know, for our attendees, we really needed to get back to somewhat normal operations by July 6th, which is when our fourth year students returned into the clinic for their clinical hands-on learning. Also, I believe these numbers are correct because someone may ask, so I'll just say, I believe since March, when this started through today, we've only had 3 positive people, 3 people in the college become positive for COVID-19. In March, we had a instructor / faculty and an intern in 2 separate parts of the building or the hospital. And we have also had one student, but I just mentioned that because of all the people we have in and out of the hospital and the college. We've done a really great job of maintaining safety, and you know, it's very possible and most likely that those individuals contracted the COVID-19 outside of our facilities, but because of the things we have in place, we were able to contain that and have the Department of Public Health do contact tracing and recommendations with regard to quarantine.
Yeah, our team has been diligent about the use of PPE, and our clients have been great with all of the changes and the things that we're asking them to do. Really have been great, and I think we're continuing to provide great service to our animal owning friends who visit us and keeping everybody safe in the process.
And the other nice thing is we've even had a few clients who have been in and later they learned they were positive and they have called in to let us know so that appropriate contact tracing could be done. Unfortunately, because both the client and all of our people were wearing appropriate PPE and physically distancing, that didn't lead to any infection. So kudos to our clients for that. Thank you, Karin. So moving on to Dr. Burkhard. Last week, we were excited to announce the college was recognized for the 4th year in a row as a Health Professions Higher Education Excellence in Diversity, or acronym HEED Award. This was bestowed upon us by the Insight into Diversity magazine. So Dr. Burkhard, can you share a little more about what this means and what the college did to earn that honor?
Yeah, thank you, Rustin. We're really honored to have been selected. This is our 4th year in a row for earning that Health Professions HEED Award. So a huge shout out to everybody in the college, because this is truly a college-wide effort. We've been highlighted for a number of different areas, but 3 probably really stand out. And the first one has got to be around our efforts around recruitment and admissions. So in 2015, our profession had just been awarded that moniker of the widest profession. And when we looked at our college data, we found that the percentage of racially and ethnically underrepresented students in our college was at 10%, which was below the average for the US veterinary colleges at the time. So this was overall a wake-up call for us, and we considered and implemented some changes, including incorporating bias training and awareness for those who are all involved in the admissions process, initiating a more holistic review process, which included separation of the file review and the interview, and using defined rubrics at each step in the process, and then really widening our recruitment process and efforts really to target and encourage students at earlier age groups to consider becoming veterinarians and coming to Ohio State University. In the 5 years since then, for our incoming classes, we have averaged 29% racially and ethnically underrepresented students, which is up from that 10%. We've had 22% male students, which was up from 15%, and 26% first generation students, and that wasn't measured prior to 2017, so we don't have that indicator. So that's one big area that we've been really acknowledged for. The second is our focus on inclusion. So it's not enough to get people here. We want those who come to OSU to thrive, both professionally and personally. And to us, inclusion means creating a space where each person feels that they're welcomed, they're comfortable, they're safe, they're respected, they're valued. The College's Diversity Committee created a Community of Inclusion Certificate Program as a way for the students, faculty, and staff to demonstrate their commitment to fostering diversity and inclusion. In the past 4 years, we've had 224 certificates that we've awarded in that program. Last year, we initiated Affinity Groups, and Affinity Groups are sites of community engagement. They're open to any member of the college, but they're really for educational activities, connections, mentoring, and building cohesive groups. And some of our current groups include the Dr. J.H. Bias Black Affinity Group, which also was selected as one of 2020's Insight into Diversity Inspiring Affinity Groups. So cool, and kudos to them. A Latinx group, a parenting group, and WVLDI, which is the Women's Veterinary Leadership Development Initiative. We also just heard a couple days ago have a brand new Asian affinity group that is kicking off. And again, these are open to any member of the college. We've also started off something called Breaking Barriers and Fostering Inclusion, and that's open to any member of the college, really as a helpful step for those who want to become allies or better allies. And then the third big area of focus for our college has been health and well-being. We believe that addressing health and well-being is really strongly linked to fostering diversity and inclusion. Be Well is the college's comprehensive health and well-being initiative for students, staff, and faculty. It's in partnership with Ohio State's Buckeye Wellness Program, and it incorporates evidence-based approaches as well as the 9 dimensions of wellness. So some of the key areas that we as a college have been focusing on have been emotional, social, physical, and financial wellness. And just one example of emotional wellness, so you have an idea of what this looks like. We've implemented MindStrong. Now, MindStrong is evidence-based cognitive behavioral skill program that is demonstrated to improve resiliency. We piloted it last year to 73 first-year veterinary students, and they had statistically significant increases in their healthy lifestyle beliefs and their behaviors. And they had statistically significant decreases in depression, anxiety, and stress. So with that data, we made the program mandatory for all incoming first-year students as well as interns and residents. So that's just a few things that have been going on. So back to you, Rustin.
Thank you, Mary Jo. We know that we do not have to accept the realities of veterinary debt as normal or unavoidable, which is why in the fall of this year, or last year actually, 2019, we offered the first ever Fall Financial Summit, which brought financial experts from across the country to Columbus in person to engage in veterinary specific frank discussions on student debt and what students can do about it. So this year we clearly, it was so well received that we had planned on having it be a requirement of all students in the first through third year this year, but we weren't able to do that in person. So we offered our first ever virtual Be Well Dollar Day, which was integrated into the curriculum so that no student in the first 3 years would miss the opportunity to enhance their financial literacy and improve their own overall well-being as it relates to finance. It exposed students to topics of cash flow, planning, investing, retirement, debt management, and many other things. And not only were they able to do the core elements, but depending on their own interests, they also could choose certain elective blocks or modules during that one-day program. So this is something that's been really important. In addition, other ways we've been trying to maintain a more affordable and accessible veterinary education at Ohio State is by trying to make sure we continue to contain or lower the debt by keeping tuition raises no more than 2% per year, which we've been able to do for the last 6 years, increasing the number and amount of philanthropic scholarship dollars distributed each year, and making it more certain that out-of-state students after their first year could rely upon paying in-state residency tuition after that first year. One of the biggest ways we've been able to impact that and also impact our debt to income ratio of our new graduates is through scholarships. So one of the things that we've done is focused on two things. One, raising dollars for scholarships, but also focused on what we refer to as transformational scholarships, which is defined by a scholarship that's at least $15,000 and could be up to $30,000. Back 5 years ago, we started off giving about $400,000 of philanthropic scholarship dollars. And each year we've progressively increased that. This year we distributed $2.3 million, which was about a 500% increase. Also during that same time, we focused on transformational scholarships. Back in 2015, we distributed no scholarships more than 15,000 or more. This year, we actually got it up to 75, and that progressed from 0 to 5 to 19 to 38 to 59, and then 75. Our goal is to raise money and be able to distribute at least $5.3 million a year. That would allow us to give every student 1 year of in-state tuition for essentially free, which would reduce their overall average debt by about $32,000. Although it's a bold goal, we believe we can make that happen. And we're challenging everyone, whether it's our alumni, our friends, our clients, our donors, to help us reach that goal. One of the ways we're doing that for alumni is we're trying to encourage people to increase the percentage of alumni who support scholarships at the college. Many of our alumni classes already have a scholarship that's named in their class. And basically what we'll do is the class who reaches the highest participation rate will be recognized at next year's homecoming celebration. So although certainly the amount helps us get there, we're really focusing on participation rate. So we will be having a scholarship challenge among classes, and that information is now posted in chat, and we'll make sure to follow up with all attendees with all of these links. I do want to draw attention to about 3 links that were posted regarding diversity, equity, and inclusion, and also health and well-being. So we hope we can have a little bit of competitive spirit among our classes to help raise money by everybody trying to have the highest % of your class contribute to that. So moving on, back to Dr. Reed. So part of our diversity and inclusion efforts are focused on creating a pipeline of prospective applicants who better represent the populations we as a profession serve. So 2 questions here. One, how has the pandemic impacted recruitment and applications for the class of 2025?
So certainly recruitment has been impacted because most of our recruitment efforts in the past involved us going out and doing in-person events. And so we can't do that anymore. We tend to do a lot of them now virtually. And the staff within the admissions office have been doing a great job of participating in recruitment events that are online and trying to build connections with students that we've had contact with, and just have Zoom meetings and one-on-one chats and things like that. But it is difficult now that we can't do these things in person.
Just one thing for everyone, over the last 2 years, not counting this year, the class of 2025, we had a 35% increase in applicants for those 2 years compared to a national average of 15%. And last year's numbers was around 1,876 applicants. This year, sorry, go ahead.
No, you go ahead, sorry.
This year, we have somewhere between 2,200 and 2,400. We have 2,400 who have started the application, and what we're trying to determine from VMCAS is how many of those completed it, and it looks like it's going to at least be 2,200. You want to speak to why you think we're seeing that type of an increase compared to the national average and our peers?
Yeah, thank you. I did want to mention that increase in those numbers, and put in a plug for if anybody wants to help us with file review, because we may have up to 2,400 applicants. If anybody has the time and the interest, we would love to have you join us and help us with file review, and then later on with interviews as well. We're hoping that the reason why our applications have surged is because people know about our program. They're hearing about the great reputation of our program and of our faculty and staff, and also the curriculum. We're undergoing a curriculum redesign at the moment, and there's lots of exciting things that have happened in the curriculum, just moving it online and making some changes and incorporating the clinical skills program. And of course, we're also going to incorporate the Frank Stanton Spectrum of Care Clinic coming up soon. And I think the word is getting out amongst students that this is an exciting place to be and to apply to.
Yeah, I'd just like to add some of the things I hear from students who choose to come here, and they have many options. Is one is those things that Dr. Reed mentioned. It's also, as part of that, the new Veterinary Clinical and Professional Skills Center that we start integrating those hands-on skills early on, first semester, first year. I think it does have to do with things that Mary Jo talked about with regard to diversity, equity, and inclusion, and health and well-being, and many of the resources that we provide them for mental health, financial well-being, and many other things. So, and actually our current students are probably our biggest advocates and ambassadors for recruitment, because they really are appreciative. I do want to just remind and echo what Dr. Reed said about the need for us to have volunteers. We're primarily in this venue talking about our alumni that are on the call. If you are interested, if you have not participated before and haven't gotten an email, please, you'll see at the end, I'm going to have you direct all questions or comments, but I'll say it now in case somebody wants it now. You should direct those questions to Tony Hare, our Director of Strategic Marketing and Communications, and her email address she will put in the chat, but it's hare, HARE.48@osu.edu. So one last thing, Emma, what changes will applicants see in the process this year?
So obviously it'll be difficult for us to bring them here on campus. And so we're looking at ways of connecting with them virtually in terms of providing them a tour, providing them connections to our students who are here, teaching them a little bit more about the program. And then also in terms of conducting interviews, we will have to be doing those in a virtual environment. Big part of our interviews usually are the interview dinners, where we invite the candidates and their family, bring them here, try to show them that we are a different program, that we really care about them as individuals, want to get to know them, want them to have a relaxing and engaging time while they visit with us, and that this isn't an interrogation. Many of our candidates tell us that the interview process, that dinner itself, is really key to why they finally do select us and come here. So we wanted to keep that same environment, that same feel. And so we're going to try and do that in a digital manner this year. And our admissions committee is going to lead the way on that. And hopefully we will make it happen in small breakout rooms over Zoom, share a meal with them.
Great, thank you, Dr. Reed. I'll just say with about 12 minutes left, if people have questions, please pop them in the chat or the Q&A area. Right now, we're going to move on, and I think this is a great lead-in to Dr. Fingland. Dr. Reed already mentioned the Frank Stanton Veterinary Spectrum of Care Clinic, but many but not all of us are working on campus at the moment. But when you do visit the College of Veterinary Medicine, you'll see construction quickly progressing on the facility I just mentioned. Dr. Fingland, what's going to happen in that clinic? Other than
great to see you all. Thanks for being here. I'm going to get out of the way so you can actually see the clinic. That is the Frank Stanton Veterinary Spectrum of Care Clinic. It doesn't exactly look like that now, but I promise you on June 1st, 2021, it will look just like that. I want to start by saying thank you to the Stanton Foundation. The Stanton Foundation has supported our Building Preeminence in Veterinary General Practice Education program. Many aspects of that program have been mentioned. The Frank Stanton Veterinary Spectrum of Care Clinic is the culmination of the Building Preeminence program. Frank Stanton cared deeply that quality veterinary care be available to pet owners, no matter their socioeconomic status. He recognized that training veterinary students to practice very broadly across the spectrum of care was the best way to achieve that goal. We agree with that. We share that vision, and the Frank Stanton Veterinary Spectrum of Care Clinic will be the culmination of that vision and make that vision a reality. The Spectrum of Care Clinic, we call it, is actually a new place for an existing service. That's really important. The community practice service will move to the Spectrum of Care Clinic next June, but they will broaden the clinical experience that students have in community practice. The reason is it will be a realistic private practice, general practice environment. It will have radiology and surgery and anesthesia and labs, just like any primary care practice. What's really important to us about this practice being across the street from the Veterinary Medical Center is that every student at Ohio State will get an opportunity to have a realistic private practice experience in veterinary college. And we recognized some time ago that not all students had that opportunity. For one reason or another, they aren't able to travel, family, children, job, whatever the reason, some because they couldn't afford it, they weren't able to get the experiences that are so valuable to training veterinarians. And this will allow us to give every student an opportunity because the clinic is right across the street from the college. It will change the way we educate students, certainly, because it is a realistic general practice, and I say is, will be. For me, in my world, it already is, but it will be a realistic general practice environment. And in there, we will have coaches for our fourth year students because part of going from novice to doctor is having a clinical training experience where the students are actually acting as the doctors. And so we call the faculty here coaches because they will be in exam room observation areas off of each of the 9 exam rooms, watching our students real-time interact with clients. One of the things that's really special about this concept is that all students from the first year to the fourth year will be participating in this private practice. First year students, second year students will spend a few hours a semester, and they will start with sitting next to a client services person, sitting next to a person answering the phone so that they understand how private practices really work from the very front door. After a while, perhaps in their third year, they may shadow a veterinary technician so that they understand the incredible value that veterinary technicians bring to a busy private practice. And finally, in their fourth year, when they're serving as doctor and they have coaches, they will actually be doing those things that doctors do in a private general practice. One focus that's really important here, starting from the first year in veterinary school, will be practice care, not just patient care. That means they'll learn how the money works, how inventory works, how personnel works. They'll work with the practice manager to learn how we price things, to understand how we deal with the financial aspect of a private practice, because that's really, really important. And in this way, our goal is to create confident, competent graduates able to provide definitive care very broadly across the spectrum of care so that we can care for pets that belong to people from any socioeconomic area, just like Frank Stanton believed many, many years ago was so important. And we believe that this practice will change the culture. It will be the force that changes the culture in how we train veterinary students in veterinary colleges today.
Roger, I know you moved out of the way and showed them the building. Could you tell them how big it is and really where really the clinical aspects or activity will be occurring?
Sure. This is a 36,000 square foot, 2-story building. The entire first floor is clinic, and about 1/3 of the second floor is associated with the clinic. No medical spaces, but support spaces. So all in all, the clinic part of it will be about 22 to 24,000 square feet.
Great. And I think you partly answered the second question. Is there anything else you want to add about the clinic, the impact, sort of the outcomes we're hoping for, anything like that?
We are excited about this opportunity. We are excited to move our community practice service into this facility. And we believe that the outcome is going to be a change in the way fourth-year veterinary students are trained in veterinary colleges.
One last question. There's a question here. Will technician students be working in the clinic, or will those roles be filled by DVMs or DVM students?
We currently don't have technician students routinely in the VMC. We used to years ago. We don't anymore. But this is a learning environment for anybody who wants to participate. And if we have veterinary technician students who we could train in this facility, we can certainly talk to folks about doing that.
Great. Okay. Well, I think that's all the questions for you now, but some may come in. I do want to address a question that came up earlier, and this was really around diversity and inclusion. And the comment or question was, we all recognize the importance of diversity for the success of the college. The college keeps missing a great opportunity to have diversity in the recruitment of interns and residents. Should we make an effort to reopen these positions to foreign nationals? For everybody, just so everybody knows, we did, and many colleges of veterinary medicine did, some still do, but mostly because of changes in immigration and the time lag to get appropriate types of visas. Used to be they could come in on a J visa or other types that were a lot easier to get, but because our residents and our interns are classified as faculty, not students, even though they're in training programs, and we don't classify them that way, the university does. It would be nearly impossible to be able to, once we go through the match and know, usually we find out in the first week of February, and we know that it takes minimum of 6 months and sometimes 9 or 12 to get an H-1B visa through or other things. So right now, it's certainly not the desire that we don't want foreign nationals coming. Many of our faculty, are international and did their training either abroad or part of it here, and we recognize the value of that perspective as well as their backgrounds and experiences. Who knows, hopefully in some ways, things may change with regard to ease of getting visas for educational purposes. And if so, we can certainly revisit that. So I did want to just make sure I addressed that question. We're getting very close on time. So I just wanted to mention one quick thing about research. And that is that in addition to COVID-19 research, Dr. Pat Green and his team just received a 5-year, $9.1 million program project grant about retrovirus models of cancer. This goes back, for those who have been around since the 80s, back to the Retrovirus Center that was started after the discovery and development of the first feline leukemia virus vaccine. But this grant is the longest running continuous program that's been funded by NIH and the NCI starting back in 2003 and going through 2025. And I'm talking about across the entire university, not just the college. And that's been approximately about $38 million of research funding. So with that, because of our time, I do want to wrap things up and say thank you to our panel. We really appreciate you taking the time to be here today and answer questions. Also, thanks to all of those of you who are attending and for your interest, your passion, and loyalty. I hope you found the information useful. You are part of our college family, and we cannot be successful without your continued support. I wish we could have held this in person this year as part of homecoming, but because of COVID-19, we can't, but look forward to doing so next year. Again, if you have any questions or comments about this format, the content, the panel, or you have any recommendations or suggestions, please send those to us. Again, send those to Tony Hare at hare.48. Tony, please put that back in at the very end of the chat. We are recording this. I believe we will be making it available to everyone. We also will be having this again this evening at 7 p.m. for those who were unable to join today. So thank you so much for all you do. We appreciate our alumni support, our referring veterinarian support, our grateful client, and other donors, and everything that you do to help us be successful. And by doing so, you will help us be the model comprehensive college of veterinary medicine in the world. So thank you and have a great rest of your day. Bye-bye.